education gaps in complex distal radius fractures in Latin America. My co-authors are Aida Garcia and Daisy Zeleta from Colombia. These are disclosures. This research protocol was funded by a mini research grant by AO Trauma Latin America. We surveyed 617 surgeons across Latin America from hand societies, AO Trauma members, and AO faculty. And we sent them a two-part questionnaire. The first part focused on demographics, and the second one included 7 clinical cases with complex distal radius fractures. We also analyzed the educational offerings by AO Trauma in the past 4 years after the pandemic. And what we found was that age and hand fellowship training were the strongest predictors for preferences for treating distal radius fractures. While older surgeons preferred more traditional techniques like external fixation, K-wires, and even volar fixation with ORIF, hand fellowship trained surgeons had a larger preference for more complex approaches and more complex fixation strategies. Regarding education, we found that there were only 4 courses focused on hand and wrist injuries in AO Trauma in the past 4 years in Latin America. Only 2 had hands-on dorsal fixation, and none had anatomical specimens. These are the fixation preferences by case. You can see our x-rays on our e-poster, so if you want to take a walk back there after we're done, you can even see how you would treat each of these cases. You can see that the main preferences were mostly ORIF with volar plates, except for some B types that were preferred with fragment-specific or dorsal plates and approaches. So in conclusion, the decision-making varies greatly between training and surgeon age. This means that there is high variability in treatment, both from subspecialty trained surgeons. In the previous module, they were talking about plastic surgeons and orthopedic surgeons, and there is a great difference there. Also, educational gaps persist in Latin America. We have a great opportunity as AO Trauma and maybe as other organizations to focus on the treatment of complex distal radius fractures. This is our contact info. Again, that's our poster ID, so you can take a look later. Thank you very much.